Hello and welcome. Today we're talking about dementia and cognitive impairment for pharmacy students. So today we have a couple learning objectives. We're going to be talking about risk factors for developing cognitive dysfunction, particularly medications, but certainly some other modifiable and non-modifiable risk factors. Comparing some of the different types of cognitive impairment and dementia, including information about its etiology and general management, talking about some treatment goals for Alzheimer's disease specifically. That is the most prevalent and has the most pharmacotherapy and guidelines associated with it. And within the pharmacotherapy, we'll be talking about anti-amyloid antibodies, acetylcholinesterase inhibitors, and memantine, including things like how they work, what they're indicated for, dosing, adverse effects, dosage forms, monitoring, all that wonderful stuff a pharmacist needs to know. And then talk about treatment plans. So this can include how often we monitor, how we monitor, managing some of the other symptoms associated with dementia, such as behavioral and psychological symptoms, and how we approach treating an individual who's been diagnosed with cognitive impairment. So there are a few resources that can be beneficial to take a look at. The Alzheimer's Association tends to have really good updated information about diagnostic criteria, guidelines, some good stuff about complementary alternative therapies, etc. So certainly a good resource to look into. The European Federation of the Neurological Societies has a number of different guidelines that are available for review as well. And in 2018, the American Academy of Neurology did provide a summary update of mild cognitive impairment. Now, it is important to note that the most recent guidelines are prior to the advent of our anti-amyloid antibodies. So guidelines don't really speak to them yet and what their role is, what their benefit is. So there is still some kind of jury's out a little bit about where to use anti-amyloid antibodies as of right now, because we don't really have good guideline guidance just yet. So a little bit of background about cognitive impairment in the United States. So nearly 2 out of 3 Americans will experience cognitive impairment as they age. So it's usually an average age of about 70 years. However, dementia lifetime risk for women is 37%, for men 24%, and the mean age of onset is a little bit varied there too. So we're looking at 83 versus 79. We also can see some differences in our disadvantaged groups. So Black individuals will have a earlier onset and a more longer duration of illness. And the similar is with low education level. So females, for example, females who are white and well educated tend to have a later onset and a more compressed or shortened duration of illness. So there is some differences to note there. What's also important to note is the general cost and impact of dementia, particularly in the world, but in the United States as well. So current estimated cost in terms of economic burden is hundreds of billions of dollars. And that comes through with things like the support that individuals with dementia and severe cognitive impairment require through things like skilled nursing facilities, hospice, nursing homes, home health, but also the indirect costs, so the quality of life years that the individual has, societal costs, personal costs, and costs of the caregivers. So a lot of times family members will step in and lose out on work and productivity to assist loved ones who have cognitive impairment. Now, this, with an aging population, is likely to continue to expand in terms of cost and impact. So the projection of economic burden is over $1 trillion in the next 25 to 30 years. And really, we as healthcare providers, managed care organizations, are poised to help decrease some of the burden, whether it's through improving treatment, streamlining access to care, making treatments less costly, support structures, community, etc.